albuterol and your Zopanex. Atrovent is in that class. It's not as fast acting. Then there's controlling medications which last 12 hours or 24 hours. If you use those when you're short of breath all of a sudden, they don't peak for about 3 or 4 hours. They're not going to help you. So it's very important that you make sure you get the proper education. And if your physician isn't giving you that education, you can always ask the pharmacist where you pick it up. If you ask your physician and it seems like they are in a hurry to get out of the room, I'm sorry. That seems to happen sometimes. Physicians seem to be changing their bedside manner from that. But ask them. They will let you know. This is your emergency inhaler. This is the one to control you. If you're on the proper control inhaler, you shouldn't have to use your emergency inhaler very often, forever. Unless you are sick and you have some type of infection, or virus or cold, something like that that you know of. Any questions? It's a lot of information, but hopefully you understand a little bit more. Yes, sir?
How about the effect of a weak diaphragm?
Good question. All right, weak diaphragm. So what does your diaphragm do? It has two functions. Sorry, what did you say?
In and out.
In and out helps you breathe.
Separation.
It's also good for posture. So, if you have a weak diaphragm, when it comes to breathing, you're not going to be able to take that deep breath in. As y'all can see, when you take a breath in, what does your belly do? It sticks out when you take that big deep breath in. Okay, if you have a weak diaphragm, either both sides or one side more than the other, you're not going to be able to take that big deep breath in. That will affect how much air you can fill your lungs with. And if you can't fill your lungs completely all the way, you will feel short of breath. And there are times that you can breathe just fine sitting up, standing up, walking around. But once you lay down, your diaphragm doesn't function properly. So if you have a weak diaphragm, there are tests that your doctor can prescribe to diagnose what the actual problem is. And then there's also different surgeries that can be done, but depending on if you can live with how you feel or if you absolutely need the surgery, you got to talk with them about that. Is that something you suffer from?
Yes, but I help it every once in a while.
You what?
When I breathe in real heavy, if I'm doing breathing exercises, I try to exercise it to try to maybe strengthen it. I don't know.
Very good. All right, so.
And also one more thing. You were talking about the inhalers.
Yes.
Right above your head, that's our website.
Yes.
And there is a very nice training film on how to use your inhalers on our website, just to
Very good.
remind everybody.
Yes.
The difference in the powder inhalers and the other type, and inhale is good really for pulmonary fibrosis. Do they really help?
So for pulmonary fibrosis, yeah, that is very controversial because your lungs are thickening the walls. And what is really happening with pulmonary fibrosis? The walls are thickening. What does that prevent?
Air from it.
And where's the air supposed to go once you get it in your lungs? Well, out into the blood. You want your air to go into your blood so you can get oxygen to feed the rest of your body. And then you want to be able to breathe out. But there's a couple different things going on. If your lungs are stiff and they can't comply with how much air you want to get in, instead of you're only breathing a little You're not getting as much air in, so you're breathing faster. But you're also not getting all the oxygen over to your bloodstream. So you feel short of breath. You're breathing faster and you're not getting as much oxygen through. There's multiple things going on. If you're doing inhalers, is the medicine getting through into your body? Is it sitting there getting absorbed by your lung tissue? Well, yes, it'll get absorbed by your lung tissue. What's the purpose of an inhaler? It's to relax the smooth muscle in the lining of your airways. So, with pulmonary fibrosis, if you're having issues with breathing out as well as in, that's where the inhalers would help, because they would relax the muscles of your smooth airway. So when you breathe out, it doesn't get so small that you can't breathe out. It depends on the manifestation of your disease. If it's to help you feel like you get a deeper breath, I'm not sure. But it's all up to your physician.
Back to the diaphragm.
Yes.
What effect does a hiatal hernia usually have on your ability to breathe?
Other than pain, it pushes up into your lung space. You can't get that deep breath in. You can't fill your lungs completely. But on that note, do we all fill our lungs completely while we're breathing every single breath we take? We don't. We do sigh, and we yawn. Our bodies do that automatically for a reason, to get deeper breaths in. So the effect it'll have is during periods of when you need to sigh or yawn, or if you are moving more and your body needs more ventilation is what it is, and that's more uptake in oxygen and more, I guess, getting rid of carbon dioxide. You won't be able to keep up with it because you won't be able to increase how much air you can move through your lungs. And also the pain will stop you from moving so much, depending on how painful that hernia is. Some people it doesn't affect their moving, some people it affects them a lot. Did that answer your question? And going back to the diaphragm, the other function of it is posture, and why that's so important. As your body needs to use the diaphragm more for breathing, it doesn't use the diaphragm for posture. So we start using our abdominal muscles a little more for posture, and our bodies roll over. And then coughing. We do this a whole lot more. Over time, our diaphragms are solely being used for breathing, which is great. But it's going to affect everything else. Your musculoskeletal system, which is your ribs and your muscles, everything else will start to hurt. And you'll get to a point eventually, and this is over long periods of time, where you won't be able to stand back up straight. And a lot of that has to do with not having the correct knowledge and awareness of being able to use your diaphragm for both posture and breathing at the same time. And there's a lot of studies out there that are beginning, and this is new knowledge. And it's a sit to stand to sit study. So what they're doing is they are timing how long it takes someone without pulmonary disease to sit, stand, and sit versus someone who has pulmonary disease to do the same thing. And a lot of it has to do with the diaphragm and posture and being uneven in their balance. Do some of y'all feel uneven with your balance? A lot of it has to do with posture and You're doing what you need to breathe.
My wife has noticed that I'm beginning to lean when I'm walking.
Mm-hmm.
And I hadn't noticed that. I have RPFT, and I'm wondering, is that, so it's, am I doing that to relieve myself without knowing?
You might be. You also, you might be using your momentum to keep you going forward. Are you also doing it, and we'll ask your wife since you're not aware of it, while he's standing, is he also punching over a lot more?
A little bit.
You could be using your diaphragm a whole lot more to try and breathe, then hold yourself up. But these are things none of us ever think of. You know, the body works together in so many different ways.
So what are they recommending you do?
So, pulmonary rehab, one of the big things in pulmonary rehab is they work on posture. And they work on, and I don't know, how many of y'all have gone to pulmonary rehab? Do the exercises sometimes seem very small and minute? Do they seem like, why am I even doing this? There are muscles that you're working that you don't realize. You might be working your obliques. You might be working your abdominal muscles so they can engage more to start helping bring you back up or bring your shoulders back up. So you can use the diaphragm to breathe, but also hold you upright. Yes, sir.
That's generally what wall pulleys and things like that.
You got it.
that you- Yeah, I can tell the difference, especially doing the one where you come down and pull that. You can feel all your diaphragm and everything in your core
Yeah.
getting you stronger.
You're not just sitting there breathing, right?
Yeah,
You're doing things, and what does this have to do with my breathing? My grandmother, she goes up in the corner and does some type of pushing off the wall in the corner. She's like, I don't understand why I'm doing this. And I'm like, keep doing it, Grandma. You're doing a great job. But I still don't understand. I said, you're exercising your arms, you're exercising everything you need to, and you're working on your balance. My grandmother does the same thing, by the way. When she gets going, she leans forward, and she keeps going. Do you have any problem in your feet, the feeling of your feet?